1. Insulin is secreted by the alpha cells of the pancreas. True or false? Answer: false rationale. Insulin is produced by beta cells in the pancreatic islets, while alpha cells secrete glucagon. This distinction is vital for understanding diabetes pathophysiology, as beta cell dysfunction is central to diabetes. 2. A blood glucose level of 45 milligrams per deciliter in an alert patient requires immediate treatment with fast-acting carbohydrates. True or false? Answer: true rationale. A blood glucose of 45 milligrams per deciliter indicates hypoglycemia, and in an alert patient, 15 grams of fast-acting carbohydrates, e.g., juice, is the first-line treatment to prevent complications like seizures. 3. Metformin is contraindicated in patients with severe renal impairment. True or false? Answer: true rationale. Metformin is cleared by the kidneys, and severe renal impairment increases the risk of lactic acidosis, a rare but serious complication, making it contraindicated in such patients. 4. Diabetic ketoacidosis, DKA, is more common in type 2 diabetes than type 1 diabetes. True or false? Answer: false rationale. DKA is primarily associated with type 1 diabetes due to absolute insulin deficiency, leading to ketone production. It is less common in type 2 diabetes, where insulin resistance is predominant. 5. Daily foot inspections are recommended for diabetic patients to prevent complications. True or false? Answer: true rationale. Daily foot inspections help detect cuts, blisters, or infections early, reducing the risk of ulcers and amputations in diabetic patients with neuropathy or poor wound healing. 6. Insulin glargine can be mixed with regular insulin in the same syringe. True or false? Answer: false rationale. Glargine's unique pH makes it incompatible with other insulins. Mixing alters its action, leading to unpredictable glucose control, so separate injections are required. 7. Exercise is safe for a patient with a blood glucose of 300 milligrams per deciliter and no ketones. True or false? Answer: false rationale. A blood glucose above 250 milligrams per deciliter indicates poor control, and exercise may exacerbate hyperglycemia or stress metabolism, even without ketones, until glucose is lowered. 8. HbA1c levels reflect blood glucose control over the past 6 months. True or false? Answer: false rationale. HbA1c reflects average blood glucose over 2 to 3 months, corresponding to the lifespan of red blood cells, making it a key marker for long-term diabetes management. 9. Glucagon is the first-line treatment for hypoglycemia in a patient who can swallow. True or false? Answer: false rationale. For alert patients who can swallow, fast-acting carbohydrates, e.g., glucose tablets, are the first-line treatment for hypoglycemia. Glucagon is used for unconscious patients. 10. Carbohydrate counting is primarily used in type 1 diabetes to calculate insulin doses. True or false? Answer: true rationale. Carbohydrate counting allows type 1 diabetes patients to match bolus insulin doses to meal intake, ensuring precise glucose control, though it may also benefit type 2 patients. 11. Hypoglycemia can cause symptoms like shakiness and sweating. True or false? Answer: true rationale. Hypoglycemia triggers sympathetic responses, causing shakiness, sweating, and anxiety as the body attempts to raise glucose levels, requiring prompt treatment. 12. Type 2 diabetes is always managed with insulin therapy. True or false? Answer: false rationale. Type 2 diabetes is often managed with lifestyle changes, oral medications, e.g., metformin, or non-insulin injectables initially, with insulin reserved for advanced cases. 13. A patient with diabetic neuropathy should avoid wearing tight shoes. True or false? Answer: true rationale. Tight shoes can cause pressure injuries or ulcers in patients with neuropathy who may not feel discomfort, increasing infection risk. 14. Insulin aspart has a peak action within 30 minutes of injection. True or false? Answer: false rationale. Insulin aspart, rapid-acting insulin, peaks at 1 to 2 hours, not within 30 minutes, aligning with postprandial glucose rises for effective control. 15. Diabetic retinopathy can be prevented by maintaining strict blood glucose control. True or false? Answer: true. Rationale: tight glucose control reduces microvascular damage to retinal blood vessels, slowing or preventing the progression of diabetic retinopathy. 16. A blood glucose of 180 milligrams per deciliter 2 hours after a meal is within the normal range for diabetic patients. True or false? Answer: false. Rationale: postprandial glucose should ideally be below 180 milligrams per deciliter in diabetic patients to minimize complications, indicating a need for treatment adjustment. 17. Patients with diabetes should avoid all carbohydrates to manage their condition. True or false? Answer: false. Rationale: carbohydrates are essential for energy, but patients should focus on complex, low glycemic index carbs and portion control to stabilize glucose levels. 18. Hyperglycemic hyperosmolar state, HHS, is more common in type 1 diabetes than type 2. True or false? Answer: false. Rationale: HHS is more common in type 2 diabetes, often in older adults, due to severe hyperglycemia and dehydration without significant ketosis. 19. Insulin pens should be primed before each injection. True or false? Answer: true. Rationale: priming removes air bubbles from the insulin pen needle, ensuring accurate dosing and preventing hyperglycemia or hypoglycemia. 20. A patient with a blood glucose of 40 milligrams per deciliter who is unresponsive should receive oral glucose. True or false? Answer: false. Rationale: unresponsive patients cannot safely swallow, so glucagon or 4-dextrose is used to treat severe hypoglycemia, ensuring rapid glucose elevation. 21. Regular insulin can be administered intravenously in emergencies. True or false? Answer: true. Rationale: regular insulin is the only insulin safe for use, commonly used in DKA or HHS to rapidly lower blood glucose in critical settings. 22. Diabetic nephropathy is primarily caused by poor blood pressure control. True or false? Answer: false. Rationale: diabetic nephropathy results from chronic hyperglycemia damaging kidney vessels, though poor blood pressure control exacerbates the condition. 23. Patients with diabetes should check their blood glucose only once daily. True or false? Answer: false. Rationale: frequency of glucose monitoring depends on the patient's regimen, but multiple daily checks are often needed, especially for type 1 diabetes or insulin users. 24. Insulin detamere has a pronounced peak action like regular insulin. True or false? Answer: false. Rationale: detamere is a long-acting insulin with no significant peak, providing steady basal coverage, unlike regular insulin, which peaks at 2 to 4 hours. 25. Continuous glucose monitoring (CGM) systems require calibration with fingerstick tests. True or false? Answer: true. Rationale: many CGM systems require periodic calibration with fingerstick glucose tests to ensure accuracy, though some newer models are calibration-free. 26. A patient with type 1 diabetes can skip insulin doses if they are not eating. True or false? Answer: false. Rationale: type 1 diabetes requires continuous insulin, basal and bolus, to prevent hyperglycemia and DKA, even during fasting periods. 27. Sulfonylureas like glipizide increase insulin sensitivity in type 2 diabetes. True or false? Answer: false. Rationale: sulfonylureas stimulate pancreatic beta cells to release insulin, not increase insulin sensitivity, which is the mechanism of drugs like metformin. 28. Diabetic foot ulcers are primarily caused by poor glucose control. True or false? Answer: true. Rationale: chronic hyperglycemia leads to neuropathy and poor wound healing, major contributors to diabetic foot ulcers, exacerbated by trauma or infection. 29. A blood glucose of 100 milligrams per deciliter before a meal requires insulin administration in type 2 diabetes. True or false? Answer: false. Rationale: a premeal glucose of 100 milligrams per deciliter is within target range, 80 to 130 mg/dl, for most diabetic patients, typically not requiring immediate insulin. 30. Patients with diabetes should avoid exercise due to the risk of hypoglycemia. True or false? Answer: false rationale. Exercise is beneficial for diabetes management but requires precautions like glucose monitoring and snacks to prevent hypoglycemia. 31. Fruity breath odor is a symptom of hypoglycemia. True or false? Answer: false rationale. Fruity breath is a sign of diabetic ketoacidosis, DKA, due to ketone production, not hypoglycemia, which causes symptoms like shakiness. 32. Insulin pumps deliver both basal and bolus insulin doses. True or false? Answer: true rationale. Insulin pumps provide continuous basal insulin and user-initiated bolus doses for meals or corrections, mimicking natural insulin secretion. 33. Type 1 diabetes is caused by insulin resistance. True or false? Answer: false rationale. Type 1 diabetes results from autoimmune destruction of pancreatic beta cells, leading to insulin deficiency, not insulin resistance. 34. A patient with a blood glucose of 200 milligrams per deciliter should drink water to manage hyperglycemia. True or false? Answer: true rationale. Hydration helps dilute blood glucose and promotes renal glucose excretion, complementing insulin therapy in hyperglycemia management. 35. Diabetic neuropathy can cause numbness in the hands and feet. True or false? Answer: true rationale. Peripheral neuropathy, a common diabetes complication, causes numbness due to nerve damage from chronic hyperglycemia, increasing injury risk. 36. Metformin is the first-line treatment for type 1 diabetes. True or false? Answer: false rationale. Type 1 diabetes requires insulin therapy due to absolute insulin deficiency, while metformin is used for type 2 diabetes to improve insulin sensitivity. 37. A patient with a diabetic foot ulcer should soak their feet daily to promote healing. True or false? Answer: false rationale. Soaking can soften skin and increase infection risk in diabetic foot ulcers. Keeping the area clean and dry is recommended instead. 38. Kussmaul respirations are a sign of diabetic ketoacidosis. True or false? Answer: true rationale. Kussmaul respirations, rapid, deep breathing, occur in DKA as the body attempts to compensate for metabolic acidosis by eliminating carbon dioxide. 39. Insulin should be stored in the freezer to maintain potency. True or false? Answer: false rationale. Insulin should be stored in the refrigerator, unopened, or at room temperature, opened, for up to 28 days, as freezing can denature it. 40. A patient with type 2 diabetes can develop hyperglycemic hyperosmolar state, HHS. True or false? Answer: true rationale. HHS is a complication of type 2 diabetes, characterized by extreme hyperglycemia and dehydration, often in older adults with comorbidities. 41. Rotating insulin injection sites prevents lipohypertrophy. True or false? Answer: true rationale. Rotating sites prevents fat tissue buildup, lipohypertrophy, which impairs insulin absorption, ensuring consistent glucose control. 42. A blood glucose of 70 milligrams per deciliter is considered hypoglycemic in diabetic patients. True or false? Answer: true rationale. A blood glucose below 70 milligrams per deciliter is defined as hypoglycemia in diabetes, requiring treatment to prevent symptoms or complications. 43. SGLT2 inhibitors like empagliflozin increase insulin production. True or false? Answer: false rationale. SGLT2 inhibitors promote glucose excretion in urine, reducing blood glucose, but do not directly increase insulin production. 44. Patients with diabetes should avoid alcohol to prevent hyperglycemia. True or false? Answer: false rationale. Alcohol can cause hypoglycemia, especially with insulin or sulfonylureas, so moderation and food pairing are advised, not complete avoidance. 45. A patient with type 1 diabetes should check for ketones during illness. True or false? Answer: true rationale. Illness can raise glucose and ketone levels in type 1 diabetes, increasing DKA risk, so ketone testing guides timely intervention. 46. GLP-1 agonists like liraglutide are used only in type 1 diabetes. True or false? Answer: false rationale. GLP-1 agonists are primarily used in type 2 diabetes to enhance insulin secretion and slow gastric emptying, not in type 1 diabetes. 47. A diabetic patient with a blood glucose of 250 milligrams per deciliter should eat a high-carbohydrate meal. True or false? Answer: false rationale. A glucose of 250 milligrams per deciliter indicates hyperglycemia, requiring insulin or other interventions, not a high-carb meal, which would worsen it. 48. Regular eye exams can detect diabetic retinopathy early. True or false? Answer: true rationale. Annual eye exams detect early retinal changes in diabetic retinopathy, allowing interventions to prevent vision loss. 49. Insulin syringes can be reused if cleaned properly. True or false? Answer: false rationale. Reusing syringes increases infection risk and reduces needle sharpness, leading to pain and inconsistent insulin delivery. 50. Patient education on sick day rules includes stopping insulin during illness. True or false? Answer: false rationale. Insulin must continue during illness, even if eating less, to prevent hyperglycemia or DKA, with frequent glucose and ketone monitoring.